My name is Alan Levi and I'm a personal trainer and strength coach based in the UK. I also have the pleasure and privilege of training Vincent Nicholas, who's a very strong advocate for amyloidosis and making society better aware of the disease and what it involves. And so today what I'm going to do is give a very, very quick talk about some of the ways that you can implement exercises into your daily activities and how you can make it safe and effective. So the first thing that we need to do before we start on any exercise program is to have a starting point. So what I call the health sat nav. So when you're going from one place to the other, you need to know where you are and where you're going. So having some sort of metrics are really important. Have something that is really practical. So for some people who are very, very fit, you might have already got those in place. You might know how many push-ups you can do, or how fast you can run, or how long it takes you to walk a mile. But if you don't, I suggest that you start today and make some. If daily activities are providing a potential problem, then use those as a benchmark. So maybe you find loading or unloading shopping or gardening or getting up and down off the sofa or the toilet really challenging. Those are good ones to use as a metric for future success, because as your strength improves, and it will improve, you'll find that these activities that in the past may have been a challenge will get easier and easier. So it's very good to have something that you can really fall back on and look back and say, oh, this is where I started. And it will often really be a pleasant surprise, because you'll be shocked at how much progress you make, and a lot of the time very, very quickly. So one of the things I would say as well is, obviously before you start on any training regime, you really need to maybe speak to your doctor about it and any particular impediments to that. But once you've had that informed conversation, then you can put a program together and start to really make some progress. Exercise is so important for people who suffer from amyloidosis, where muscle structures are being broken down. Maintaining that muscle tissue is so important, and one of the biggest problems I see is that there's this over-reliance on talking about cardio training. Personally, I would say that you really don't need to worry that much about cardio. Just walking or cycling or gardening is ample. Some people may have had pacemakers, some people may have cardiac issues, some people might have cardiomyopathies. I don't want people jumping on a treadmill or something like that and putting more strain on them, because the main question is also, why do we need to do that? You're not necessarily running a triathlon. That might be your goal, but I'm assuming for the most part it's just better health and well-being. If that's the case, you need to train accordingly. And so I would say, don't worry about cardio. And whenever I've heard doctors talk or there are any discussions about physical training, the onus tends to be on that. Resistance training is what I'm really discussing, and I would argue that's the most important thing. The next thing is also, it doesn't need to be done with weights. During lockdown, Vincent and I have made huge gains and strides just using resistance bands or body weight. That's really all you need. And actually, if you're a bit inventive, you can make them very, very challenging, as I'm sure he would agree. So that's one of the key things is really, I would say there needs to be a greater focus on resistance training. Why? Because those muscle structures are being broken down by amyloidosis, and we want to maintain that integrity as much as we can. So next thing is posture. Posture is really important. Vincent's probably rolling his eyes up if he hears this, because if posture didn't matter, I wouldn't waste 5 minutes on it. If walking around like this or like this didn't have any impact on performance or your health or well-being, why would I waste any time on it? The problem is it does. As I talk to you now, I'm at home sitting down. My hip flexors, I'm in hip flexion, so they're getting tighter and shorter. My hamstrings are shortened. My head is lolling forward as I talk into the camera, so my head is out of optimal alignment, which means that the weight of my noggin is going to be translated down my spine. Now, my head might be about 5 kilos, in which case that's all going down my vertebrae, which is going to put a lot of load and potentially cause lots of dysfunction and problems. So you can see straight away that just being seated is a real problem. In fact, a lot of people say sitting is the new smoking, because there's so many dysfunctions that occur to the body. Even my breathing is going to be much more shallow, because I'm going to be more concave across my chest, so I'm going to be breathing through my upper respiratory my accessory muscles here, rather than deep diaphragmatic breathing. So posture is key, especially because sometimes with blood pressure issues like postural orthostatic hypertension, you might find that your head will drop forward because raising it makes you feel dizzy. But it's still good to get used to that posture, obviously, carefully, because after a while, that forward head drop position will become embedded as a motor pattern. So you'll be doing that even when you don't need to. So some of the things that you need to really think about are stretching out things like the hip flexors, the hamstring muscles, the chest muscles, and really activating the mid-back muscles. So some of the things that Vincent and I do are band pull-aparts, just a length of band, you grab them and then pulling apart with your arm dead straight, you bring it past the center line, really squeeze the shoulder blades back and then come back to that position. And what that does is it strengthens the muscles in the mid-back, like the rhomboids and the lower trapezius, and those really help and benefit posture while reducing your risk of shoulder injury and giving you a much more upright posture. The next thing I was going to discuss is really one of a nice little principle of resistance training, which is the law of repeated endeavor. Now, this was really brought to me by Russian strength coaches, and what it basically involves is stripping away the idea of training as straining. Like, I've just done my 200 burpees and push-ups, and I do that for an hour a day, and that's it. I would spread your exercise out over a longer period of time. It's better for your adrenals. It's much more beneficial for the central nervous system, because you're what they call greasing the groove. You're repeating and repeating. So the firing from the brain to the muscle improves. It also is managing fatigue. What do I mean by that? As amyloidosis patients, I don't want people exhausting their body. Hence why I'm not particularly keen on wiping people out on cardio, because I don't see what the benefit is. The main thing is I want people stronger. And there's not really much time to discuss this, but there's a big difference between weight training and strength training, and there's a continuum. Where you are on that continuum is very important. So here is endurance, and here is brute strength. It's lifting the most you can for one rep. And where you want to train is sort of in along that line, but constantly changing it. So you're not always training the same kind of muscle tissue. And strength is so key. So one of the best ways of training strength is doing, for example, 5 push-ups on the hour, every hour. Find your maximum level and then divide it by 2. So you might go, I can do 25 push-ups. Okay, we'll do 10 every hour. And suddenly you think, well, over the course of a day, I've easily done 60. That's much better, and you'll find that there's a lot less lactic acid built up, which will be basically the chemical byproduct that gives you that stiffness afterwards. You go, oh, I can hardly walk. And we don't want that. We don't want that in this particular instance. Okay, so just choosing an exercise. I used to do this with chin-ups as an example. I had a chin-up bar outside my home, and what I'd do is every time I went outside, I'd do a few chin-ups. And it is absolutely stunning how you can build up your strength that way. So now I wanted to talk very briefly on supplementation. And one of the things that is very key is, obviously, because of the muscle breakdown that amyloidosis causes, we need to look at supplementing appropriately. And one of the things I'm a big fan of is branched chain amino acids, because they are what protein breaks down to. So for most people with amyloidosis, they need to get more protein in, because they're fighting that kind of tide of the muscle breakdown. So you want to, I would say, for a man at least have 2 palms worth of protein with every meal, and for a woman have 1. Obviously, some of you may need to discuss this with a doctor. I'm not a big fan of very high levels of protein intake, especially if you had things like kidney issues or liver issues. So it's probably best for discussion, but I would have a source of protein with every meal. I think that's a fair and reasonable amount. I don't think that's excessive at all. But if you were thinking of having more and having a very high level of protein in your diet, I would probably get medical assistance with that, or consultation. So some of the other vitamins and minerals that are very key, I think, are B vitamins, because of the central nervous system and the nerve damage that amyloidosis can cause, and the peripheral nervous system nervous damage. So having adequate B vitamin status is very, very critical. And I do think, having a B complex would do people a lot of good. Another one is vitamin D. I could talk for an hour about vitamin D. I won't bore you with it, but basically every gene we have has a receptor for vitamin D, which basically means that every body function that we have is supported by vitamin D. Vitamin D inadequacy will hasten death. Irrespective, all-cause mortality will go up when you've got low vitamin D. So I'll get tested to make sure you're within ranges. Some countries have woefully inadequate ranges. I can find the levels and send them out to you guys if you're interested, that I think are adequate. You want them high. I've seen in the UK we've got absolutely abysmal levels. So when I get clients back, they say, oh, I came in the normal range. I'm like, that is not the normal range. You definitely need to up it. I'm very, very keen on it, not only because it affects every system of the body, and therefore there's no reason to presuppose that that doesn't include amyloidosis. But also in the current environment with COVID, it actually has been shown to reduce your risk of getting COVID by 34%. And all the people in intensive care, 82.2%, had low vitamin D. So please get your vitamin D levels up, even if you've had the jab. And then another one that I think is really interesting is lion's mane. Lion's mane is a mushroom extract. It's been shown in clinical studies, and these are gold standard, placebo-based double-blind studies, that it will actually remove amyloid plaque from the brain. So it helped people with Alzheimer's and Parkinson's, with recall and with cognitive issues. Whether it does that in the body, I don't know. I would love for somebody to do a clinical study on it, and a good, placebo-based random controlled study, and come back to us on that, because I think that could be really interesting. But meanwhile, if you're having cognitive issues or forgetting names, etc., then that's highly recommended. Once again, it's called lion's mane. I'm sorry if I forget on the Latin term for it, but a good company is 4-Sigmatic, and you can get it as a tea, and I highly recommend it. So those are some of the key principles. I do hope that's been of use and interesting. I'm more than happy to give them my time in the future and discuss further things if anything sparked an interest or there was a particular area you wanted me to expand on. But for the time being, I hope that was useful, and I look forward to getting your feedback. Take care.